So we are going to be performing Rejuvenized Peel today. This patient has very good skin and very good condition. It does tend to be a little thicker and have a little bit more acne once in a while. We start with the #1 solution, which is a prep. It removes all the oil off of the skin so that the peel absorbs evenly. Smells a little bit, so we like to leave the fan on.
It's a little alcoholic.
Yep.
So it's not bad.
Nope. This is the Rejuvenized peel. It is the strongest of the SkinMedica peels right now. That is considered the prep layer. I like to apply, they tell you to do it with the cotton. I usually do it with the Q-tips. Reason being is that the product is not being absorbed into the cotton. You're actually using it nice and evenly on the patient's skin. Obviously we want to avoid the eye area but get close. We don't want anything dripping into the eye. Working underneath the eye area will help to smooth soft little lines under the eye, give a new fresh texture to the skin. I always like to say peels are like teeth whitening. I think they brighten your skin so beautifully and kind of hit a reset button at the end of summer to get rid of all of the dead skin that you sort of collected on your little trips to the beach and the pool with all the layers of sunscreen. This patient does a very good job with sunscreen. You can see that her skin is not tanned. She's Italian, she has a beautiful tone, but she's not suntanned at all. We're going to work on the soft little pigment here on the sides. After a series of 3 or 4 of these, which should be done once a month, she will notice much brighter, healthier looking skin tone. Her at-home products will work better, whether she's using all prescription or partial prescription, partial cosmeceutical products. That does vary from patient to patient. Their lifestyle, medication, what their goals are. If you are using prescription skincare, we do have you hold the use of the tretinoins, hydroquinones, and all of those types of products for 1 week. If your skin feels normal in 1 week, you can go back to the prescription. If it does not, we usually have you wait up to 10 days. Winter time tends to be a little harder because of the furnaces being on, so it makes our skin not want to bounce back as quickly as the warm humidity and all of that. It tends to actually help our skin more than what we realize. This can be done full face, neck, and there can be a smidgen left over for chest. So again, this is layer #2 in the Rejuvenized peel. Layer #3 is going to have a little bit of resorcinol, retinol. It's really going to make sure that the patient peels well. Some of the soft little frosting you're seeing is because she uses medical grade skincare. That's actually a good thing. It means she's going to get a nice peel. Typically our faces can take a little bit more than our necks. Our necks want to give us a little bit more pushback and little irritation, so you may have to use like a Vaseline on your neck, where your face can sometimes take a little bit more. So now we're going to move into step #3, which again is going to be the retinol and resorcinol. You're going to notice that it has a yellow little tint to it as we're applying up over top. These peels are self-neutralizing. You do wear them home. If you are an early morning patient, you can wash your face before bed. If you're a later in the day patient, we usually require you to sleep in the peel. During the winter time, that can sort of be bothersome because your skin can feel quite dry. So as long as usually you're noon or before, you can wash your face around 10 o'clock before bed. And you see it has a light little yellow tinge. As it tends to oxidize during the day, you will notice a little bit of a yellow hue starting to get a little darker. You can always take a bronzer, a mineral bronzing powder to put over top. We just don't want you to do any liquid type foundation because it will liquefy the peel. I would rather you stay inside, clean out closets, aren't really in the sun. Can't go to soccer games and sit outside for hours, anything like that. During the week of the peel, I just sort of want you to have as minimal outdoor time as possible. So winters tend to be the best. I also think these are excellent to prep for lasers. If you do 3 or 4 of these and get your skin in really good condition, then the doctors are able to choose a really great laser appropriate for every patient to give you an even better outcome. How are you feeling? Okay, Bernie?
No.
Okay.
A little tingling?
Tingling?
But
Okay.
not burning.
Some patients experience more. I think the healthier the skin, sometimes the more burning you'll feel. But you definitely respond very well to peels, so. And the one thing that I want to say is that, you know, I feel like when you're keeping your skin healthy and wanting everything to stay younger and firmer and tighter, the pores to be better, you want the surface of the skin to be in the best condition it can be in. Peels will really help you achieve that quite quickly. There's not many people that walk the face of the earth that don't need one from time to time. So then we would finish with a nice sunscreen. Again, if you don't want to liquefy the sunscreen, you can do a Color Science brush over top.